In honor of National Complex Regional Pain Syndrome, or CRPS Awareness Day, or Color the World Orange Day, I'm detouring from what I had planned for this Sunday's video so I can highlight the debilitating condition that thousands of people suffer with. 1 in 3,800 to be exact, or in broader terms, 150 to 250,000 cases in the USA alone. So, buckle up your orange seatbelts. This way for CRPS. Right this way. November. The whole month of November just happens to be CRPS month. So bringing as much awareness as we can to it is really, really important. We're showing our support by wearing our orange, and there are so many ways to donate to this cause as well, which I will link in the description. Okay, on to the green eggs and ham of this illness. Sounded better than the meat and potatoes of CRPS, but didn't really land. Anyway, CRPS occurs 3 to 4 times more often in women than men. Although it can occur at any age, it is rare in children and adolescents. In the pediatric population, the onset usually occurs in early adolescence, with the lower end of the range falling between 7 to 9 years. And in adults, the age of onset is highly variable, from 37 to about 70 years of age. Complex Regional Pain Syndrome, or CRPS, and I will use the two interchangeably throughout the video. It is a broad term describing excess and prolonged pain and inflammation that follows an injury to an arm or leg and involves high levels of nerve impulses sent to that affected site in the body. It has an acute, meaning a recent or short-term form known as CRPS1, and a chronic, meaning lasting greater than 6 months, form known as CRPS2. In type 1, there are no nerve injuries or lesions identified. CRPS type 1 is also known as reflex sympathetic dystrophy, and it comprises about 90% of all cases of CRPS. CRPS type 2, also called causalgia, on the other hand, is diagnosed when there is evidence of nerve damage. Causalgia. What am I thinking of? What does that remind me of? Causalgia. Wingardium Leviosa. That's what I'm thinking of. Anyway, I digress. So people with this debilitating condition have changing combinations of spontaneous pain or excess pain that is much greater than normal, following something as mild as a touch. Other symptoms include changes in skin color, temperature and or swelling on the arm or leg below the site of injury. Other symptoms include change in skin color, temperature and or swelling on the arm or leg below the site of injury. Although CRPS improves over time, eventually going away in most people, the rare, severe, or prolonged cases are profoundly disabling. Most CRPS illnesses are caused by improper function of the peripheral C fiber nerves that carry pain messages to the brain. Their excess firing also triggers inflammation, which is designed to actually promote healing and rest after injury. And a side note, when we say nerve firing, we mean that a nerve impulse, which is how neurons communicate with one another, is sent out from a nerve body, and this has to do with sodium channels and action potentials, which I won't get too deep into here. But basically, our cells send impulses through the exchange of sodium across its membrane, and when it reaches a certain amount within the nerve cell body, it triggers the cell to open, and the impulse fires. So imagine a jug of water that has a door. And when the water reaches a certain level, it hits the door, which opens it, and the water rushes out. That kind of sounds like a toilet. because it's the same concept, really. So moving on, let's get into the signs and symptoms associated with complex pain syndrome. So the most common and prominent symptom is the pain that affected individuals feel. The pain is often deep inside the limbs with a burning, stinging, or tearing sensation. In rare cases, pain and other symptoms occur in a matching location on the opposite limb. This mirroring pain is thought to reflect secondary involvement of spinal cord neurons or nerve cells. Mirror pain is less severe and resolves as the injured nerves recover. Sensory changes are also common and may include increased sensitivity to painful stimuli, feeling pain from stimuli that are usually non-painful, like bed sheets resting lightly on a person but causing severe pain. And the term for this is allodynia. And in some instances, sensory loss or numbness, basically. In addition to pain, people also commonly experience an affected extremity becoming warm, red, and swollen, at least initially. In many patients, as CRPS continues, the affected extremity may more often feel cold with dark or even like bluish skin. Swelling resulting from fluid buildup in the limb or edema can be present regardless of the color and temperature of the skin, but is typically more prominent with the earlier presentation we just mentioned, which is the red and warm skin. Skin color and temperature may sometimes change even over short periods of time inconsistently. So they may also experience skin that becomes thin and shiny and may have either increased or decreased hair and nail growth in the affected extremity. Motor impairment is another concern with this syndrome. This is the decrease in the ability to use the limbs for movement, with weakness or limited range of motion being the most common impairments. The impairments may present with a reduction in strength in hand grip or during tiptoe standing. So some patients may develop spasms or even uncontrollable muscle contractions, and this is called dystonia. The exact cause of complex regional pain syndrome is actually unclear, but it's likely that there are multiple factors contributing to its development. The first possibility being immobilization or casting, which keeps the limb from moving in order to allow it to heal and is a common treatment for injuries such as broken bones or fractures in the limb. In adults and pediatric patients, CRPS type 1, which remember is no nerve damage, was commonly seen in those who have a history of immobilization. And this was associated with a worsening of symptoms. Next, complex pain syndrome may also be caused in part by alterations to the nervous system. One part of the nervous system is the sympathetic nervous system, which is activated in fight or flight situations. So I'm sure all of you have heard of fight or flight. So what this is these are times when the body is in a high stress situation and basically requires alertness. So this system constricts blood vessels to reduce blood flow to the extremities when this is actively occurring, and it's because the brain, in all of its infinite wisdom, is shunting blood towards the heart, the lungs, and the brain, so it can act in quick bursts of action. In contrast, low sympathetic nervous system activity increases blood flow to the extremities. In CRPS, sympathetic function may initially be decreased, which could contribute to the warm, red, swollen limbs, but ultimately this is still unclear. Third, inflammation may also play a significant role in the development of this syndrome. That's usually the case with every chronic illness. Actually, inflammation is always at the core. Inflammation is bad. CRPS, particularly in its early stages, it's found that people have increased level of inflammation-causing substances called cytokines being released by the body. Along with the inflammatory cytokines, there are also pain-enhancing substances in the nerves that are released. The increased inflammatory and pain-producing substances in CRPS are a possible explanation for why a person may experience pain from a stimulus that normally should not be causing pain. Fourth are genetic factors, and they may also contribute. However, there is no clear genetic risk pattern known at this time. There are a few genes that may contribute to CRPS, but the ones most frequently identified are in genes that influence the immune system and inflammation. It is possible that particular genetic patterns a person is born with might increase the risk of developing CRPS after injury, but there is no evidence that CRPS is a disease that can be caused by genetic factors alone, if that makes sense. And finally, there are psychological factors such as anxiety, depression, and anger. And they may worsen CRPS symptoms. In children, psychological issues are often assumed to play a greater role in this condition than in adults. But this belief also remains largely unproven. Now, there are a few other conditions and diseases that may mimic CRPS, so it's important to have a plan with your doctor or your patient if you're a healthcare practitioner watching this to rule out those other conditions. And these include infection of the skin, muscle, or bone, because these can cause redness, swelling, and pain, much like CRPS. And laboratory values that indicate inflammation and measure white blood cell count are usually elevated with infections, but they are not significantly changed when this is CRPS. So remember that. The second is vascular disease, or diseases that affect the blood vessels may also present the same way. Clotting of the veins in the legs and feet can produce redness, swelling, and pain in the affected extremity. And those clots can also cause the feet to become discolored and cold due to the reduced blood flow in the area. This can be distinguished from CRPS by using a form of ultrasound to identify the decreased blood flow resulting from the clots. Another type of vascular disease is called Raynaud's disease, which is a condition in which the blood vessels in the hands and fingers overreact and constrict in response to cold temperature and emotional stress. I actually have Raynaud's syndrome, and I was looking for pictures of my hands in the past when I've been actively having an episode. I don't know, I don't know what they call Raynaud's when it kicks off, but it's alarming. It's kind of freaky. It's definitely alarming when you see your fingers turning purple or white, stark white. I'll try and put a picture up somewhere around here. So Raynaud's phenomena can be diagnosed by examining the hands to see if they are unusually sensitive to cold temperature, which is marked by a skin color change of blue and or white. Arterial blood pumped down to the hands and feet must fight gravity to return upwards in the veins to the heart. C fiber damage can impede this, permitting blood fluids to remain in the limb where the swelling then further blocks return blood flow. So it's kind of like a vicious cycle. Slowed circulation makes delivery of oxygen and nutrients needed for healing difficult and sometimes causes spreading of cellular injury. Breaking the cycle by reducing limb swelling and restoring circulation is often the key that permits recovery to begin. People should keep CRPS-affected arms and legs elevated when resting or sleeping to help the excess fluid return to the heart. So exercise every day, even if only for a few minutes. It's critical to improve circulation and oxygenation. Physical therapists can actually help devise an exercise regime, and you're in that much pain that any little bit of movement is difficult. For some individuals, compression stockings or sleeves can limit the swelling, particularly when standing. I am a huge fan of compression stockings, especially when I was working in the hospital, because being on your feet for 12 hours, the blood would tend to pool. Compression stockings, I'm a fan. Rheumatoid arthritis is next and is a chronic inflammatory disease that affects the joints, which can cause pain. So what makes rheumatoid arthritis different from CRPS is that rheumatoid arthritis affects the joints. Next is factitious disorder, which I've never really heard of, but factitious disorder is a psychological disorder in which a patient will fake physical or psychological problems and has a need to pretend to be sick. These causes are usually difficult to identify and diagnose, but close observation and psychiatric support can help properly diagnose factitious disorder. Don't all kids have this from like ages 5 to 18? I think so. Mine did. So for complex regional pain syndrome, an actual diagnosis is made solely based on history and physical. CRPS is suspected when a patient's symptoms develop 4 to 6 weeks after limb trauma, and symptoms cannot be fully explained by the initial trauma. And the symptoms are regional, affecting again an entire limb. So there is criteria that is used in the diagnosis of this disorder. It's called the Budapest criteria, and it's used to confirm that the characteristics of complex regional pain syndrome are present, and it has 4 components. First, the patient has continuing pain that is disproportionately painful to any event that provokes it. Second, the patient must report symptoms in at least 3 of the 4 following categories: sensory, which is an increase in sensitivity; vasomotor, which is temperature or color changes in the skin of the affected limb; pseudomotor, or edema, which is sweating changes or swelling; and motor trophic, which is motor impairment or changes in the hair, skin, and nails. Third, the patient must also exhibit signs which are observable by the healthcare provider in at least 2 of the 4 categories above: sensory, vasomotor, pseudomotor/edema, motor, and trophic. The last component of the Budapest criteria is that no other diagnosis can better explain the signs and symptoms. There's no gold standard test, unfortunately, for diagnosing CRPS, and the diagnosis can be made with no testing at all other than the examination by a medical professional. It seems like a lot of the chronic illnesses that we've talked about lately, multiple sclerosis or MS, peripheral neuropathy or PN, and now CRPS, are diagnosed by a process of elimination due to there not being perfectly really a single one of these that presents straightforward, with the same symptoms every time. It can be very nuanced to diagnose these types of chronic diseases. It can be very nuanced diagnosing these types of chronic diseases. It's often a combination of testing and examination and patient history. Nerve conduction studies detect some, but not all, CRPS-associated nerve injuries. So 2 tests that can be done, but they're not necessarily needed to diagnose CRPS, but sometimes a lot of doctors, if they kind of need that final, push over the edge to diagnose CRPS, they'll do one of these. The first one is a bone scan or a bone scintigraphy. And they're sometimes used to support a CRPS diagnosis, basically. So in CRPS affected limbs, bones that receive signals from the damaged nerves can become affected. And these abnormalities are often visible on X-ray or other imaging where they help specialists pinpoint the location of the nerve damage and identify best treatments. Diagnostic sympathetic nerve blocks are next, and while also not required for diagnosis, are sometimes used to help determine the degree to which the sympathetic nerve activity is contributing to the pain. So standard therapies and treatments, and if you guys hear my neighbor's kids outside, it's beautiful here today. It's about 70 degrees. It's, I think, November 5th, and it is like a beautiful summer day outside. Anyway, so yes, the kids next door are having a great time. So they are in this video, whether I like it or not. And so is somebody cutting wood. Anyway, CRPS is treated approaching it from different areas, which are physical therapy or PT, occupational therapy or OT, and medications. The goal of treatment is to manage the pain and to increase mobility of the affected limbs. PT and OT are considered first-line treatments, and some available therapeutic methods that can be used include desensitization, strength and flexibility training, vocational support, coping skills, training, postural control, gait retraining, enhancing ability to carry out daily activities, and relaxation techniques. Another possible rehabilitation method that can be used is graded motor imagery. This method is used to train the brain to enhance motor coordination and function of the limbs that are affected. Individuals are taught mental exercises, including how to identify left and right painful body parts while looking into a mirror and visualizing moving these painful body parts without actually moving them. This is thought to provide non-painful sensory signals to the brain that helps reverse brain changes that are prolonging CRPS. It's really actually pretty cool. We've come such a long way with this. But yeah, I mean, if there's one thing through this whole presentation and video that I want to know more about, it was that one. Next is pharmacological or drug therapy management of CRPS. So pain is a major concern, obviously, with this disease, and this can be managed with a variety of medications that can reduce and control the pain. Pain management is important so that a patient with CRPS can undergo physical therapy with minimal pain. Anticonvulsants may be useful also in treating pain that is associated with damage or nerve injury, or what's called neuropathic pain. Drugs such as gabapentin and pregabalin are options for treating neuropathic pain, and these drugs have modest effects for its reduction. Topical creams containing lidocaine can also be used. And if you want more information on neuropathic type pain, check out the video that I did on peripheral neuropathy. You might find that pretty interesting. There's a lot of good information in there. So anyway, another standard treatment for CRPS is certain types of antidepressant drugs, even if a patient is not depressed. And these drugs can cause chemical changes in the brain that may help reduce pain and also improve sleep, which is a huge problem in people with CRPS. Biophosphonates such as Fosamax, which is what most people have heard of Fosamax. But anyway, Fosamax is a biophosphonate, and it may be beneficial in patients with complex pain syndrome as well. And they work by inhibiting the breakdown of bone cells by cells called osteoclasts. However, it is unlikely that bisphosphonates help with CRPS pain by this mechanism. Glucocorticoids or steroids are another treatment option for complex regional pain syndrome. And there is some evidence that they may be effective, at least in the early stages, like the first few months. But in people who have had it for a longer duration where it's a chronic issue, glucocorticoid treatments may have really no beneficial effects, unfortunately. Opioids are next, and they may also be used. However, there are very few studies that have investigated the use of opioids, and they don't really show they're effective either. The use of opioids may be considered if other options, although opioid medications obviously carry significant risk. Okay, next we're talking about interventional procedures, which we had touched on earlier when I mentioned sympathetic nerve block, and can be used to block the nerves by injecting local anesthetics such as lidocaine, which may result in a decrease in pain sensation for some patients, though there's currently very little evidence showing it's effective in CRPS. Others have been actually really greatly helped with this. So it's kind of a toss-up as to whether or not this helps. Anybody out there, if you've had this, definitely, drop a comment and let me know what's worked for you. It seems like complex regional pain syndrome is just becoming more and more prevalent, and I'm not sure why that is, but maybe better diagnosis, I'm really not sure. But anyway, next is spinal cord stimulation, and this is another intervention which may be beneficial for patients who have not adequately responded to the interventions we discussed above. So, spinal cord stimulation uses an electrical pulse stimulation to control the transmission of pain signals in the spinal cord. And this treatment is relatively safe and reversible, but may be pretty expensive. Investigational therapies are every day I hear about another clinical trial or an expanded use of a medication for complex regional pain syndrome. Again, I think it's because it's becoming so prevalent, and we have a better understanding of pain today. We have a better appreciation for maybe complaints from people that did not fit neatly or squarely into a particular box. And now we're starting to look at this and say, oh, okay, maybe all along this was complex regional pain or peripheral neuropathy or some type of neuritis. There's so much expansion and better understanding now. So that's a very good thing. Investigational therapies for information on the current clinical trials, I will post them down below. They're on the internet at www.clinicaltrials.gov. And then for information about clinical trials being conducted at the National Institute for Health in the Clinical Center in Bethesda, Maryland, I'll also drop that down below. So I hope this gave you a really good overview of CRPS. I talk to patients, many patients every day with this as well. One of the treatments that we use is IVIG. And there's a lot that goes into this therapy, but so many of our complex pain syndrome patients have used IVIG and have found it tremendously helpful and beneficial. My heart goes out to anybody who is suffering from this and managing the day-to-day symptoms of this. If you want to drop a comment and chat about any questions you might have or what other possible treatments are out there, by all means, I would love to connect with you one-on-one. So if you want to know about IVIG, which is one treatment for CRPS, you can check out these videos here. I have a whole IVIG series. Couldn't put it in this video, of course. I didn't really even touch on IVIG, I don't think, but definitely a good thing to know if you are diagnosed with this. And I'll see you there. My neighbors. Hey. So many times I've had people walking by on the street and they're like, what is she doing in there?